Hi everyone, welcome to ResearchMD.com. My name is Dr. Pramil. Great presentation today. Let me introduce myself. My name is Dr. Pramil. I'm an associate professor of medicine in one of the large medical schools. Also work as like a chief medical officer in the United States. So today's our topic is a recent study, the role of lemon juice in prevention of kidney stones. Okay. So first thing, let's look about the kidney stones. When we talk about kidney stone, what's the first thing come to our mind is the pain, severe pain. Most of the people, if you talk to, describe the pain as having like a baby. But in females, if they go to delivery, they usually get an epidural. But in this situation, you start having sudden onset of pain, it's excruciating pain. When talk about also the kidney stones, what does it usually also it can cause? It can cause blood in the urine, it can cause obstruction in the kidney and cause like infections, and it can also cause, when you have an obstruction, it can cause like, your kidneys stop functioning and you can have like renal failure. So when you look at the kidney stones, like what are they made of? Most of the stones are called calcium oxalate stones, okay? When you talk about the calcium oxalate stone, like around 90% are calcium oxalate stone. Then you have like a uric acid stone, you can have like steroid stones, and then you can have like cysteine stones. But mainly when we think about kidney stones, we're thinking about calcium oxalate stones, okay? Now, when you talk about lemon juice, like there's a lot of nutritional benefits of lemon juice. Most of them, most of the studies are clinically proven. So let's look at the components of the lemon juice, mainly when we talk about the carbohydrates. When we talk about the carbohydrate, there's like fructose, sucrose, and glucose are the main component, okay? Then you have like vitamin. You got vitamin C, everybody knows about that. You have potassium, you have vitamin B6, and look at the other major component, you have like citric acid. That's what, that is what the key player in prevention of the kidney stone. You can have like antioxidant, like aspartame. You got like a diosmin. And did anybody think about like, when you talk about lemon, the smell come from limonene, D-limonene, that's a component in it. That's what kind of produced that smell. When we talk about, and so today's topic is going to be the great study recently published, and it was actually done in Italy. Piero Rugamendo is the primary author on the study. Very good study because of randomized control study. They've given cases and the controls. They have given the cases 2 glasses at 60 ml twice a day, and look at the prevention of the kidney stones. And so when you talk about kidney stone, how does people get kidney stones? So you have this calcium and oxalate come to the urine, okay? They combine. When the urine get concentrated, they combine and they become like a stone-like material, and that's what like obstruction and the cause the pain. So how does this lemon juice help? In the lemon juice, what do we have lemon juice? Lemon juice have like a lot of citric acid, right? The citrate combined with the calcium. So when you have citrate combined with the calcium, it does not the calcium does not have a chance to combine with the oxalate. Remember, in order to produce a kidney stone, you have to have the calcium combined with the oxalate to produce it, okay? So in this case, when you drink lemon juice, you get the citrate in there, citric acid, they go and combine with the calcium. So you prevent the calcium to bind with the oxalate, so you will not have stones, okay? That's the main physiology behind all this. And so all of this, what is the main results of the study? If you drink like 60 ml of lemon juice daily, when you talk about twice daily with your, with your regular diet, the stone formation is going to be extremely less. So it's a very, very important study. Thank you so much for watching. We'll be back with another presentation soon. God bless.